Watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Welcome back, our dear viewers, from that short commercial break. Thank you for keeping it at the Doc Talk Show. This show is sponsored by the Ministry of Health and Cameline Men's Collection, and we are at the time we went into the short commercial break, we are still talking about the complications of diabetes mellitus, because Dr. Kamala said that due to poor health-seeking behaviors of our people, they usually come when it is very late. So we want to know which complications are those that people with diabetes mellitus tend to have that at times insinuate them to come and seek care. What are those complications of diabetes, Dr. Kamala?
One of the things that people living with diabetes get is ulcers on the foot. So we call it a diabetic foot. So they are prone to getting wounds on the feet because the diabetes damages the nerves and also impairs blood flow to the feet. So they often get wounds on the feet, and these wounds are quite dangerous, more dangerous than if you didn't have diabetes, because when you have diabetes, your immunity is already very low. So those wounds are going to progress, they're going to become worse and worse. They are not easy to treat. So even if you use the antibiotics, the regular antibiotics, they may take a long time to heal. And if unfortunately it doesn't heal, it just grows bigger and bigger. It can take up the whole foot, now becomes affected. And some people even unfortunately lose their feet or maybe their leg. So that's one of the complications that people living with diabetes get. In fact, one of the things that we emphasize a lot when we are talking to people who have diabetes is foot care. So first of all, they're supposed to keep their feet very clean. Short nails, keep your nails clean. The foot must be examined every day, and even when you're washing your feet, you must wash it in detail, carefully. You must wash in between the toes, wash the heel, and there are certain shoes that are also recommended for people who have diabetes. Yes, there's a certain footwear that's preferable. Footwear that gives your foot enough, that does not compress your skin so much to further impair your blood flow.
So like the shoes should not be so tight.
Yes.
They should be a bit loose.
Yes, the shoes should not be so tight. They should be loose, and there's some types of shoes that also have a certain base that allows your foot not to be compressed.
Like the sole?
Yes.
The sole down.
Yes.
So, Dr. Kamala, you talked about something that I picked interest in, and that's examination of the foot. What are those things that I'm basically looking out for if I'm maybe showering at my place and I know that I'm diabetic? What are those things that I'm basically looking up to maybe think that I'm at risk of developing a diabetic foot, so that it does not progress, because we want to do more of the prevention? So what are those things that I'm actually looking out for?
Yes, so when if you're diabetic or you're living with someone with diabetes, when you're looking after the feet, one, you should make sure that you do not needlessly walk barefoot. So where possible, you should wear shoes to protect your feet. And then when you're examining your foot, you should look out for any change in the skin color, or look out for any areas where you feel you do not have much feeling, numbness.
Because of the nerves you talked about?
Yes.
Oh.
And also any swelling or any cut, by the way. If you see any cut or any wound, it should immediately prompt you to look after it very properly.
Thank you so much, Doctor, for that detailed elaboration. I will go to Dr. Sechanzi to give us other complications.
Well, thank you very much. So apart from the diabetic foot, there are quite a number of other complications for this condition, diabetes. And I think our viewers should note that there are quite a number of patients whose first presentation, or the first time they get to know that they have diabetes, is when actually they have had a complication. Now, like this wound, somebody could have a wound that is not healing. Somebody could have an ulcer. They try everything. They try to apply creams. They apply medicines, but the wounds are not healing. So sometimes it's always important to check out that sugar and see how it is. But apart from the diabetic foot, this condition can actually result in so many complications, starting with our very own eyes. There's a condition called diabetic retinopathy, whereby because of this too much sugar, it's going to affect some of the structures in the eyes, and it's going to result into our patient not able to see very well. We get quite a number of patients who are actually having vision problems, and we recommend that they go and be evaluated by ophthalmologists who try to find out how much of a problem is there, and they advise on what to do. Sometimes it can be as serious as them requiring to get some operations to correct some of these complications. So diabetic retinopathy is one of the commonest complications. But apart from that, because this sugar is too much and it has direct effect on the blood vessels. So blood vessels are everywhere. They are there in the brain, they are there in the stomach, they're there in the abdomen, they're there in the kidneys. So everywhere where there's a blood vessel, actually there could be a problem, because this sugar being too much, it's one of the things that causes the blood vessels to harden, what they call atherosclerosis, that hardening of blood vessels. So because of this, there are actually some other conditions for which you are at an increased risk of things like stroke. Okay, so a patient who has diabetes has an increased risk of having
getting stroke.
Yes, and then apart from that, also the heart itself, because much as the heart is this organ that pumps blood, but the heart also requires blood to be able to work. So if the blood vessels in the heart also get these problems of atherosclerosis, they harden simply because of too much sugar, they get damaged because of too much sugar, somebody is actually at an increased risk of heart problems, including things like heart attacks. So diabetics actually have an increased risk of heart attacks. That said, there's some other things like the kidneys. Okay, the sugar can affect the kidneys, resulting into a complication called diabetic nephropathy. Okay, so patients who have diabetes, usually they tend to actually get complications, especially if they're not well controlled and their sugars are quite high. I'm glad Dr. Kamara has fully told us about what happens in diabetic foot. So quite a number of complications can happen, but most of them stem from the fact that this sugar, when it's too much in the body, is going to affect the blood vessels. And the moment you affect the blood vessels, you're going to affect the way nutrients are delivered into the body, how oxygen is delivered, how waste products are removed, and this can cause problems into the whole body. Yes.
So that means that diabetes mellitus nearly hits every organ in the body.
That's it. Even things like UTIs, much as yes, UTI is an infection, but if somebody has diabetes, actually their risk of getting these UTIs are quite
high. Why is it that someone with diabetes is at an increased risk of ending up with a UTI?
So, well, these organisms, the bacteria that cause these diseases, most of them also consume on glucose. Okay, most of them consume on glucose. So if somebody has had these sugar levels that are very high and they have damaged the kidneys, there comes a time whereby some of this glucose can even leak from the kidneys and it gets into the urine. Now this bacteria body needs this oxygen, just like body needs this glucose, just like our body cells need it. So the moment these bacteria find places that are rich in glucose, they will take up that glucose, they will feed, they will reproduce and multiply, and will cause things like infection. So things like infections are very common, even the fungal infection ones, because you realize that yes, this diabetes, it weakens our immune system. It's one of the conditions that will put our immune system down, and it will put us at risk of many opportunistic infections. Infections which take advantage of the fact that our immunity is low. So we be at an increased risk of such conditions by virtue of having the diabetes mellitus.
Thank you so much, Dr. Sechans, for that interesting discussion. I have actually noted that if you have hazy sight, you never know. It could be retinopathy that is insinuated by diabetes, so you really need a checkup. Maybe something that I request to interest our viewers in. If someone has diabetes, like you've said that if this is a complication that is coming as a result of having diabetes. So I'm living with diabetes and I don't want to reach this step of complications. So how frequent should I visit a health worker? How frequent should I maybe test for the kidneys to find out how they are working? How frequently should I look at how frequently should I visit my ophthalmologist to see how my sight is? How frequently, if I'm living with DM, how frequently should I really go and visit those specialists to find out?
Well, thank you very much for that question. Now, for patients who have diabetes and they have had this diagnosis, like you mentioned, it's one of the chronic illnesses that you're not going to treat in one day and the next day you're okay. So it's a condition that might require you to take medication for quite a long period of time. And usually what we do in our clinics is that when we see these patients, we give them drugs that will run them for some period of time, but then we give them review dates. we can give them maybe a month or 2 months or 3 months, depending on how serious the condition is. And then after that period, you can always review them, see how their sugars has been controlled. Of course, check also their pressures and see how they have been controlled. Screen for things like infection or any of the complications that can arise. And then from that, we manage them accordingly. So we give them these periodic reviews, and from that, you can always assess and see how they are and intervene accordingly.
Okay, so how these reviews can be like weeks, months, or
so usually depending on someone's sugars and maybe any other possible comorbidities, but usually do about a month, 2 months, or 3 months,
depending on how the sugars are being controlled. So after like 1 month, they come back. Oh, thank you so much. On Dr. Show, we always say that prevention is far much better than cure. So if you have diabetes, please ensure that you visit health workers, let them examine you, let them screen you for these complications, because we don't want the diabetes to exacerbate into developing complications. We are going for a short commercial break, and when we come back, we shall be talking about living with diabetes. How best can you live with diabetes safely so that it does not exacerbate into complications, because we don't want to develop complications. So let's go for a short commercial break. We shall be right back.
You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.